Welcome to Vision for California, a web series of discussions on California's healthcare reform, hosted by Senator Dr. Ed Hernandez, Chair of the Senate Health Committee. Today's guest is Peter Lee, the Executive Director of the California Health Benefit Exchange.
Thank you for joining me. Today we'll be talking with Peter Lee, Executive Director of the California Health Benefit Exchange. Peter, welcome, and thank you for being with us today in Visions for California. And again, congratulations. I believe it's your year of being with the exchange. So how's it feel?
Feels great,
Good.
Senator, and great to be with you.
Well, thanks a lot. Let me just ask the first question. What is the California Health Benefit Exchange?
Yeah. The Health Benefit Exchange is going to be one of the main vehicles through which upwards of 5 million Californians are going to get access to coverage come January 1, 2014. The exchange is going to be a marketplace where people will get subsidies to help them buy health insurance provided by the federal government.
So tell me, how does somebody buy insurance then through the exchange? How does the average California citizen do that?
Yeah. Well, come January 1, 2014, we're going to be close. We aren't going to be all the way there, but we're going to be reaching really close to getting to universal coverage in California. So for about 3 million Californians who are individuals who would love to be buying insurance but they're uninsured, through the exchange, the federal government's going to give them a tax credit that they can use to shop through the exchange and buy the private health plan that's right for them. In addition, the exchange is going to be doing a statewide marketing campaign in partnership with the state to help people get into Medi-Cal who are going to be newly eligible for Medi-Cal.
You know, just following upon that comment you just made, and you know, I've been going throughout the state, been talking to a lot of my constituencies, and there's a lot of uncertainty of what's going to go on and how. How are you going to get that message out to the consumer? How are you going to get that message out that somebody that's now going to be eligible for Medi-Cal where in the past they weren't? What's your plan? How are we going to do that? How are we going to achieve that?
Yeah, you're right, Senator. There's been such poor information and misinformation about the Affordable Care Act. One of the things we need to do is to level set. So starting in March of 2013, which is about 5 months away from now, we're going to be doing what we call a air war and ground war. Now, I'm not a militaristic guy, so that's probably the wrong metaphor, but we're going to be doing paid advertising, TV, radio, print, targeted for the diversity of California. We have a very diverse state, and we've done a lot of research with a private firm we've contracted with to find out, well, Hispanic community, radio and TV, big time. Some of the Asian groups, newspapers, targeted towards the Lao community, et cetera. So we're going to be doing paid media. But in addition, we're going to be in every community, actually doing community grants to help churches, schools, community-based groups doing on-the-street outreach to educate people on what the Affordable Care Act is.
And when does that start? Is that something that starts within the next 6 months? Does it start in 2014? And then the next question, what happens if you don't achieve your goal to get individuals to start signing up for the exchange?
Right. Yeah, that's going to start in 2013.
Okay.
So it's going to start in March 2013, but people can start enrolling in the exchange come October 2013. Now, coverage will start in January 2014, but we're going to do everything we can to have everyone in California hear again and again that coverage is possible, it's affordable, and we've got a way that they can make the right choice for them through the exchange. Okay. We won't get everyone right out of the gate. Right. So this is a starting line, not a finish line. We're going to be doing ongoing outreach, community work, advertising about both the exchange and Medi-Cal, started in 2013, but this is an ongoing go-forward effort that's going to be happening for the future of California.
Now, whenever I go in my district, I always talk to the various chambers of commerce, and there's a lot of concern about businesses, small businesses. A lot of them aren't sure at what level is like over 50 employees that they have. They have to provide health insurance. If it's under, they have to buy it on their own. Speak to me a little bit about the small business. Does a small business under 50 employees have the ability to purchase through the exchange? And those employees, if not, how do they buy through the exchange?
That's a great question, Senator. So here's what's going to happen as of January 1, 2014. Everyone has an obligation to have insurance. So individuals will pay a penalty if they don't get health care that's going to be made affordable through the Affordable Care Act. Large businesses, which is businesses over 50 employees, will also be required to offer insurance for their employees. And if they don't, they're going to pay a penalty. Small businesses, 2 people to 50, will not be required to offer health insurance. We hope they will, and one of the things the Affordable Care Act is actually provides tax credits. So small businesses that have low-income individuals, less than $25,000 a year, they're going to actually get a big tax credit to help them buy insurance. But there's not a requirement for small business. Small business, we hope they'll participate. Healthcare is really expensive, though.
Yeah,
Small businesses are really struggling, and so they will not be required to offer health insurance, but they can absolutely come to the exchange. Some will get tax credits, others will use us as a way to give their employees choice.
So somebody with less than 50 employees can get not only a tax credit, but they can also purchase the insurance through the exchange as well?
Absolutely.
Okay. Now, a company with over 50 employees, will they be able to purchase through the insurance as well, or will they do through their traditional way?
The over 50, it's their traditional routes. One of the things we've been charged in the legislation that established the exchange is a few years out, let's get set up, get the millions of individuals covered, help small businesses get insurance, and report back to the legislature. How's this working? Do we want to expand and reach to 100 employees, reach a larger? But we're starting at individuals and small businesses to look at and report back to the legislature, should we go bigger?
All right. Well, you know, obviously there's this, the fear that, you know, once this comes into effect that I won't have the same benefits that I had before. Let's talk just briefly a little bit about the grandfathered plan. So obviously the exchange won't affect that at all. So if somebody has an insurance through their large employer, they've got a grandfathered plan, they're going to continue to get that. They will not have to purchase through the exchange. Is that correct?
Absolutely right. This is, you know, what this is doing, the Affordable Care Act here in California, is first, if you have insurance today, keep it.
Right.
Doesn't change it. What it is doing, though, for everyone, it's saying, you know, right now insurance can be very confusing. And one of the things the law does, inside and outside the exchange, is we want to make sure everyone gets good benefits. And so there's going to be a standardization of benefits across the board over time. That's going to be the individual market, small employer market, that whether you're in the exchange or outside, but you can still buy outside the exchange, you're going to know you're going to be covered for everything you need, what are called essential health benefits.
Okay. Let's talk a little bit about that, comparing to buying inside the exchange and outside the exchange. Governor Brown just signed recently the law that states that there's what's called the essential health benefits. So whether you buy inside or outside, you're guaranteed that coverage at an absolute minimum.
Absolutely right.
So tell me the difference then. Is the difference then that if you buy the exchange, that's where you get the subsidies as opposed to not?
Yeah.
Just tell me, let's talk a little bit about that.
Two big differences. The number one difference was the biggest one, is that for individuals, you can only get access to this subsidy, which is literally the IRS, the federal tax agency, is writing a check every month to the health plan you pick to cover anywhere from 90% to 50% of your premium. You can only get that through the exchange. In addition, though, we're going to be creating a website to help you make the right choice for you. The prices that you pay in the exchange, identical for the same product you get outside of the exchange. But we're going to create a shopping environment where you can make the right choice for you. So the advantages are, number one, subsidies to make it affordable, and number two, a shopping environment to make sure you make the right choice that's the right choice for you. Well,
let's talk a little bit about the exchange itself, because I know there's going to be that concern with the consumer out there saying, well, it's a government-run program, you know, I don't know if I trust it, you know, I want to go with my private individual. Tell me how you're going to, I'm a consumer, tell me how you're going to convince me to purchase through the exchange. What is it, what are the benefits besides the fact, number one, the biggest one is the subsidies, which are very, very important. How do you convince me that this is an important issue for me to buy that product through the exchange?
Yeah. Well, I want to come back to that subsidy, because and we've been actually doing focus groups, meeting with groups of Californians all across the state. And they say, I would love to have insurance.
Right.
I just can't afford it.
Right.
You can give me a leg up. With many of us that have jobs, we get a leg up in buying insurance because our employer helps pay for it. With the Affordable Care Act, in essence, the federal government's saying we're going to be that big employer for the rest of us, to give us a leg up, to help us buy insurance. And so, again and again, Californians have said, boy, that's the kind of leg up that I want and need. So that's the number one thing. The number two thing is, we aren't forcing you into a particular plan. It's all about choice. It's creating a marketplace. And so we've just heard, just this last week, we've asked which plans might participate in the exchange. Over 33 of the health plans around the state of California said they want to participate in the exchange. They've noticed an intent to bid. And that's showing the amount of interest, the amount of competition. So when a consumer is thinking about where do they want to go to choose, it's not a matter of choosing sort of scrappy, you know, bottom of the barrel plans. We've got the best plans in the state, and those are what people will pick from.
Let's talk a little bit outside of the exchange. Obviously, an insurance company can sell, insurance agents will do it. How do we know that there's not going to be somebody out there who is unscrupulously going to be selling junk insurance?
Yeah.
What are the protections for the consumer? Because what I'm looking for is the consumer protections.
Absolutely. A couple things are changing come January 1, 2014. The exchange is important. That's a big part of it. But it's also totally changing the rules as well, you know, for health insurance writ large. Today, health insurance companies, in essence, make money if they avoid sick people.
Right.
Those rules are changing entirely. Come 2014, and this is very important, everyone's going to be guaranteed coverage without being underwritten for their health status, both inside and outside the exchange. So for many people, let's say you make good money, you might not be eligible for a subsidy, but you can't be turned down. You can be guaranteed you're going to be issued health care when you apply to a health plan inside or outside the exchange. That's a game changer. But also for the health plans, they're going to be told, if you try to play by the old rules and try to avoid sick people, we're going to actually take money from you as a health plan and give it to another health plan that actually says, we'll have our fair share of diabetics, our fair share of people with asthma. These are market-wide rules that relate to the entire insurance market, inside and outside the exchange. So we all need to be part of a healthcare system that's about wellness, about delivering better care, and not about playing insurance games.
And this is, I'm assuming, how we're going to reduce costs and spread the risk, by having more individuals purchase insurance, spreading the risk, but also guarantee that they have insurance, guarantee issue, as well as what we call community rating. Tell me a little bit about the community rating. It sounds kind of confusing. If somebody buys, explain to me how that works in a geographical area.
Yeah. How it's going to actually work is statewide, we're going to be looking at what the rates are based on everyone who's in the individual market. Okay? And so it's not a matter of saying, what's this little plan with its 5,000 people or 10,000 people? It's saying, we want to make sure that the entire risk pool, which is everyone covered in the individual market, everyone covered in the small group market, is going to be insuring one another. That's what insurance should be all about, and not a matter of gaming the risk, but rather, let's get everyone in the tent so we're spreading the cost of when you or I might get sick. We're all paying for that over time. So community rating is basically saying, let's not play a balloon squeeze, avoid risk game. Let's get everyone in the tent.
Well, we all know California is taking a leadership role in all areas, including healthcare. The first to have an exchange. We're moving forward. We're going to fully implement it. What are your biggest challenges?
Yeah, we've got a couple challenges. One that you noted earlier is, to date, the Affordable Care Act, which is what provides these subsidies, people have been very confused about it. It's not been educated well. So one of our big challenges is making sure we communicate. We educate through media, community-based outreach, et cetera. Number two, we need to get affordable products. It's all about affordability. And so we're working very closely with health plans, consumer advocates, doctors, hospitals to say, let's get products that people can afford. Third, enrollment. We need to help people enroll. As easy as we try to make it, it's still going to be confusing. So we're actually going to have literally tens of thousands of people that we train across the state. So if you're having trouble on that website, which we think will be really easy, you can go to someone in your community who speaks Spanish, who speaks Hmong, who speaks Farsi. Say, help me enroll in this thing. I don't quite get it. We know that we need to make it easy. Doing that, a lot of the case, in person is going to be critical.
Well, it sounds like you have a challenge ahead of you. I'm convinced that you're going to do a great job. Let me thank you for joining us today. And more importantly, welcome to California and the Exchange, and thanks you for having me as a guest.
Great.
Thank you very much for joining us today.
Today's production of Vision for California with Senator Ed Hernandez featured special guest Peter Lee, the Executive Director of the California Health Benefit Exchange. We invite you to check back for upcoming segments. Thank you for watching. See you next time.